Hello, my name is Brian. Today we're going to perform upper body bath. Let's begin. Note, before I begin, I don't have a pair of gloves because I can't find a pair, and you need 2 pairs of gloves for this session, and also I will verbalize on some other items that I don't have with me. Okay, let's begin. Knock knock, may I come in? Thank you. Hello, my name is Brian. I'm going to be your CNA for today. Can I see your ID? Great, thank you. Okay, Mr. Lorraine, today I'm going to be cleaning your upper area. Is that okay? Great. Here's the call light. Feel free to use it. I'm going to gather my supplies and I'll be back. I'm going to wash my hands. I'm going to exit. And I'm going to grab my supplies. You're going to have a barrier, table. Okay, so it starts with a barrier first. Shampoo, lotion. We're going to verbalize that this is deodorant, not aftershave. So you're going to need deodorant, orange stick for the nails, in between and under, thermometer, 2 hand towels, 2 washcloths, a bath blanket, and a nightgown. We're ready. Okay, I'm going to wash my hands and 2 pairs of gloves, which I don't have. Just note that. Wash my hands. Knock knock, may I come in? Hello, Mr. Lorraine, I'm back. Okay. I'm going to check your brakes very quick before I change the water. Lower your bed. No, you want to lower the bed because you never know, just to avoid accidents. And of course, check the brakes for safety. Okay, Mr. Lorraine. Here's the call light. I'm going to grab some water. I'll be right back. You're going to be in the same room. You're just going to the bathroom and change the water, so you don't cross-contaminate. Turn the water, adjust. Remember, the water is supposed to be between 105 and 110 degrees. Okay. Check 1. Okay. Check 2. Okay, 107. And check 3. You're going to let your patient check to see if it's good for him. Mr. Lorraine, I need you to check the water for me. Is it okay? Great. Okay, so the water's good. You're now going to begin. We're going to start with the brakes. 1, 2, 3, 4. You always want to do it before and after for safety. Mr. Lorraine, I'm going to raise your bed for your safety, body mechanics. Okay, great. Mr. Lorraine, I'm going to close your curtains. This way you provide privacy. Okay, they're closed. You're going to apply, of course, you have your first pair of gloves on. You applied these when you went to get the water. So this is your first pair. I'm going to lower the side rail, Mr. Lorraine. There you go. And I'm going to drape you with a bath blanket. Okay. There we go. And you don't want to shake anything. Remember, you don't want to shake blankets or anything when you're doing this, or they will ding you. Okay. Now that it's fully clothed, Mr. Lorraine, if you could, I'm going to tuck this right behind your shoulders, okay? And I'm going to remove your top sheet. There we go. Okay. There we go. Mr. Lorraine, if you could come towards me, that way you provide proper body mechanics. If you can't, it's okay. I can help you. From behind the shoulder to the waist. 1, 2, 3. There we go. You want to be sure that you bring him closer to you, within the bed. From the waist to the thigh. 1, 2, 3. Perfect. To the thigh, to the ankle. 1, 2, 3. That way, it's safe on your side. Okay. How are we feeling, Mr. Lorraine? Good? Okay, good. So now, Mr. Lorraine, I'm going to start with your face. Would you like shampoo? Yes? Okay. Again, you want to give the patient options and promote independence. So, you're going to want to place the cover over here. There we go. Please note that these are a pair of gloves, number 1. Okay. You're going to grab your first washcloth, make a mitt. Go. Tuck it in. I can do it again. There you go. You're going to want to sit right there. Fold it in between. There we go. And then, voila, tuck it in. Okay. So you're going to dip it in water. No shampoo for the eyes because it will irritate. You want to do everything after. There we go. Dip some water. Okay, if you could close your eyes, Mr. Lorraine. On the count of 3, I'm going to clean both eyes. 1, 2, and 3. 1 and 2. You want to flip sides on each eye. Set it down. Okay. This fell. That one fell, so please excuse me. So you're going to want to pat dry the eyes now. Mr. Lorraine, if I can have you close your eyes, I'm going to dry your eyes. Okay? 1 and 2. Perfect. Okay, this part, you're going to want to apply shampoo, and you're going to clean the forehead, under the cheeks, under the chin, and behind the ears. So, let's begin. Not too good for Friday. Okay, so I'm going to dip, water, shampoo. Okay. Mr. Lorraine, I'm now going to clean your face, okay? Here we go. 1, 2, 3. Mr. Lorraine, if you could look towards me, I'm going to clean behind your ear. Okay. There we go. Thank you. Get behind the ears, under the chin. Go. If you could look away from me. Thank you. There we go. Perfect. Okay. Mr. Lorraine, I am now going to dry you. Pat dry and rinse out the soap. Okay, you ready? If you could look towards me. There we go. Perfect. There we go. If you could look away from me. Get behind the ears, the cheeks, forehead. There we go, we're done. Okay, so now I'm going to remove the hand towel, everything inside out. Place it down. You're going to remove the gown at this point now. Mr. Lorraine, I'm going to remove your gown. Is that okay? Great. You always want to ask permission, and of course, dignity, respect. You want to be sure you look good for the Red Cross. So, there we go. Untie it from the back. You're going to slowly remove it. Be sure you don't expose them. You want to make sure you maintain privacy and that they don't feel intimidated. Okay, there we go. Okay, slowly just slide it under. Okay, Mr. Lorraine, I'm now going to expose your right arm, okay? Well, usually with Red Cross, you want to start with the arm farthest away from you, and then work your way closer. So, I'm going to expose your left arm, Mr. Lorraine. Thank you. You're going to want to place a towel under. Be sure you don't shake anything. Again, the Red Cross will ding you, and it's not pretty. Okay, tuck it under. Okay, make sure you can see the axilla or the armpit so you can clean it in between. Okay, Mr. Lorraine, so now I'm going to start with your left hand. Dip it in with water, place soap, and you're going to want to support the elbow. So you're going to begin smooth cleans going downward, starting with the front area, all the way to the back and the side. 1, 2, 3, and 4. As you can see, I rotate every angle, so as I clean each side. Thank you. And I'm going to clean your armpit now. 1, 2, perfect, thank you. Mr. Lorraine, I am now going to rinse out the soap. Make a mitt, same routine. See the way I do it? Fold it inward, full circle, tuck in the rest, inside. Here we go, support the elbow again. 1, 2, and 3. And with the armpit, excellent. I'm going to clean in between your armpit, Mr. Lorraine. 1, 2. Perfect. Now I'm going to place a bath basin with water aside. Mr. Lorraine, if you could wiggle your fingers, you're now going to be cleaning his fingernails, under, in between, and all over. If you could wiggle your fingers, thank you. You're going to start with each one. 1, 2, 3, 4, 5. Again, this is the orange stick that you're going to use to be sure that you clean underneath. Thank you. Support the elbow, remove, set it down. Okay, so now make a mitt. You're going to clean the hands in between and all over. Okay, Miss Lorraine, dip, put shampoo. I'm now going to clean all over your hand. Okay, 1, 2, 3, in between. 1, 2, 3, 4. Great. All the way down. Thank you. Mr. Lorraine, I'm now going to pat dry you. And dry, you want to be sure you dry hand, all the entire arm, and of course under the axilla. There we go. Great. Support the elbow. Fold everything inward. That way the contaminated part stays inside and the clean part stays outside. Okay. Set it aside. And of course, I'm not going to do the other arm. I'm just going to do the same routine as I did with this arm. Would be the same. That way we cut down the chase and move on to the next one. Okay, Mr. Lorraine, I now clean both your arms. Here's the call light. If you need anything, let me lower it. Your bed. I'm going to grab some fresh new water and I'll be right back. Thank you. Raise the side rail. The water that was contaminated. I have my pair of gloves number 1. I'm going to remove, wash, rinse, pat dry, and now it's clean. Remove pair number 1. Wash hands. Apply pair number 2. Okay. Place water. Do the 3 checks. Check number 1. Behind the wrist. Okay. Check number 2. Thermometer. Okay. In between 105 and 110. 107. Perfect. Okay. Come back. Hi, Miss Lorraine. I'm back. You have pair of gloves number 2, so don't forget. I brought you some water. I want to be sure. 3rd check. Let me know if it's okay. Great. Thank you. Okay. There we go. Okay, Mr. Lorraine, I'm going to clean your chest. Is that okay with you? Great. Okay, so before I do, I'm going to check, of course, safety. Break number 1, 2, 3, 4. Safe. Adjust the bed to waist level again. Right, you're going to bring it down, bring it up. Bring it down every time you leave, just for safety. And when you're here, of course, you want to keep it up so you maintain your proper body mechanics. So, all the way up. Perfect. Bring side roll down. Okay. Before I do that, let me just You're gonna expose the chest area. I'm gonna expose the top area, Mr. Lorraine. Okay. Okay. I'm now gonna apply some shampoo. Dip. Shampoo. Here we go. It's gonna feel a little warm, okay? There you go. Make sure circular strokes are the best. So all over. There we go. Perfect. I'm now going to pat dry you. I'm going to dry out and remove the shampoo. Go. Perfect. Mr. Lorraine, I'm now going to place a cover. Cover to make sure you maintain privacy. And you're going to clean the lower part. So you do the top and then lower. Now, note, if you see any redness or anything, verbalize it to him or her and inform them that you will tell the nurse as soon as you finish. So, dip shampoo, okay? And as you can see, there's a little redness here, right below the chest, right below the breast. Mr. Lorraine, I seem to notice a little redness below your breast. As soon as I finish, I will inform the nurse. There we go. So we're done. So, you're going to rinse. You do circular strokes with shampoo. Make sure you clean everywhere. And now, under the breast. Now, for female, you do the same. You want to ask permission so you maintain that respect and privacy. Mr. Lorraine, I'm going to clean under your chest. Is that okay? Thank you. And you want to avoid the red area. Be sure. You don't want to irritate it. There we go. Thank you. I'm now going to rinse. There we go. I'm now going to just remove the shampoo. Thank you. I'm going to pat dry. Okay. Restore bed sheet. There we go. And remove this. Thank you, Mrs. Lorraine. We're now done. Almost. And now you're going to place, this is where the new nightgown comes handy. You're going to do the back next, but before you do that, you want to be sure you have the nightgown ready. Mr. Lorraine, I'm just going to place your nightgown very quick, okay? And this part's a little tricky, depending how you do it. But you want to be sure you have a little knot, so that way you just tuck it right under his head. And voila, it's ready. So, Mr. Lorraine, I'm going to place your nightgown on. There we go. Under, lift your head. There we go. Thank you. Now, in this case, they may have a weak arm, or the way we say it, affected arm, and then the good arm, unaffected. You want to be sure when you change a resident that you always want to start. Let me put this over here. Make sure he's... You always want to start on the strong arm, the unaffected arm. That way there's more mobility. Slowly tuck it in. There we go. Perfect. Now with the affected arm, you want to be sure you're very careful, okay? They may feel sharp pain, slow pain, it depends on their condition. So slowly, there we go. And just to note, when you remove the gown, there we go. No, when you remove the gown, you remove with the affected arm first. And then, or remove with the affected. When you remove the gown, you want to start with the unaffected arm, the good arm. There's more mobility, and then you remove the last one with the unaffected arm, or affected, I'm sorry, and vice versa. So, now that he has that, perfect, you're going to have him bend his leg. Mr. Lorraine, if you could bend your leg, thank you, cross your arm, you can prepare to turn in, place the towel underneath, and you're going to clean off his back as the last part of the session. So, if I can have you turn, and if you could look away from me, we're going to turn you the opposite side, and you're going to hold on to the side rail, okay? On the count of 3. Support his leg, shoulder. Here we go. 1, 2, and 3. And if you could hold on to this, there we go. Hold on to the side rail. That way you can promote independence. Thank you. Okay. I'm going to place a pair of blue chucks. It's called, of course it's a towel, but it's verbalized. This will be blue chucks you're going to be putting in. Okay. There we go. Mr. Lorraine, I seem to notice that there's a little redness underneath your, right next to your bottom, so I'm going to report it to the nurse as soon as I finish. Okay? Great. Dip. Shampoo. Circular strokes. Of course, you want to be careful. You want to use the, of course, your weak hand or unaffected hand to spread the bottom cheeks and proceed cleaning. So I'm going to open. If you could come in. So there's a redness right here, as you can see. Slight redness. You're going to want to avoid that area just so you don't irritate it. And report to the RN as soon as you finish. So, verbalize. I'm going to open it. Again, strokes. There you go. And you don't want to push it in. You're going outward. You want to push the dirt out. So, outward. There you go. There you go. Avoid the red area. Perfect. Okay, Mr. Lorraine. I am now going to rinse you. Dip. No shampoo, of course. I'm going to remove the shampoo. Spread them again. Slowly upward strokes. You want to push the dirt outward, not inward. There we go. Especially for females, you want to be very careful. You want to avoid UTIs, which is a lot more common in females. So, now that he's done, I'm going to fold the blue chuck inward, and then you're going to bring him back and remove the blue chucks. Mr. Lorraine, we're going to come back, okay, on the count of 3. 1, 2, and 3. There we go. Thank you. Let's just straighten you up a little bit. There we go. If you could come towards me. Remove the blue chucks. Dispose. Okay, there we go. Okay, Mr. Lorraine, now that everything's set, you're going to want to be sure now. I'm going to remove the bath towel and restore your top sheet. So as you do this, again, it's tricky. At the same time, you're folding the outside part inward, and of course this part, vice versa, the same way, at the same time. So that way you don't expose the patient. Okay? There we go. And then you just remove this gown, of course, from the previous. Okay. There we go. Everything inward. This will be disposed. Place on the table. Okay. There we go. Okay, Mr. Larry, before I finish, let me just make sure that he's comfortable. How's that feel, Mr. Lorraine? Are you comfortable? Okay, and a toe pleat. That way you don't avoid a lot of pressure on his feet. Okay, perfect. Okay, Mr. Lorraine, we're now done. I'm gonna close the side rail. And let me just lower the bed. Again, you want to lower the bed every time you leave to provide safety. Of course, if they fall, the fall won't be as significant as it would be if it was high. So, you want to lower as low as you can to the floor, unless he requests it. So, Mr. Lorraine, I now lowered your bed. And we're now done. Is there anything else I can do for you? No? Okay. Well, again, I just wanted to thank you. Here's the call light again. Feel free to call me if you need anything. And thank you for being so patient. Thank you. Okay. Now that you're going to get the items. These items, bath basin gets washed, pat dried, washed, rinsed, pat dried, restored. Reusables are restored. In this case, in between, before anything else you want to apply lotion and deodorant, which I didn't add to the video. But don't forget, before you finish, after you do the back, you're going to want to offer lotion to keep their skin dry, and deodorant, so that way they maintain proper hygiene. Thermometer, everything else gets restored, washed, rinsed, pat dried, restored. Dirty linen goes with dirty linen, trash goes with trash. Clean it, and you return it. Inform him that you return the table. If he needs anything else, place call light within reach. Remove gloves, wash hands, okay? And you're gonna exit, and then you're gonna record and report, then exit, and that concludes upper body bath.